This is Athena Jezik, and I'm going to show you working on the front of the leg, the thigh, the knee, the calf. We're not going to go into the foot today. And again, I'm using kind of a solid oil that melts as soon as I put it on my hands and get it in contact with the skin. Okay, and I always check the flow of the fluids, making sure that there's not any congestion. And this is done by a mapping technique, which all feels pretty good. Check the knee, the tightness of the knee. You can tell by the way the cap moves how tight that is. This moves good. She was moving some boxes. There's a little bit of bruising along the shin, so I'll be very careful as I go along there. It's not anything overly concerning, but it's just a tender area that needs to be handled with a little more care. And I'm just starting by doing some thumb ironing up along the shin bone, and then on the inside as well, not going on the bone, but right next to it. I go along the side where there's quite a bit of muscle from the shin wrapping around into the calf area. It's just a downward push. There's not a whole lot of muscle here. There's muscles that are longer in nature, and sometimes they feel a little sinewy. Sometimes they feel very tense. And here we work a little bit of circular motion, petrissage and kneading into the calf. And if you keep your strokes longer and make sure that you feel into the tissue, letting the tissue guide you to some degree, but letting it tell you exactly how much pressure to use. Even though I'm going over the bone here, I'm going over very, very gently, and then going in with a little more depth on either side. Coming up into the knee, working around the cap. And you can just work your fingers in. A good idea is just get an anatomy book and study that anatomy book really well. Just look at the pictures and see how things fit together, where they attach, what's behind them, what's on top of them, what's next to them. And then you'll have an illustration in your head when you're working somebody. You'll have a little bit of an idea what you're doing as far as how the anatomy is placed. And then we do the same thing up this iliotibial tract, which is the long side of the thigh, outer thigh. Taking that up with, it's a thumb iron, but I'm using my fingers. It's a effleurage, but I'm using more of the fingers. And a kneading across the quadricep muscles, the 4 different muscles here. Picking up that top muscle, working underneath it as best as possible. Kneading it. Now there's an inguinal triangle, which is about this much area of the leg. You basically want to stay away from, unless you have some skills that you know what's underneath there. There's lymph, there's nerves, there's a lot. It's a better idea to stay away from it, unless you are familiar with the structures underneath. You can do a little kneading over the top of it with just a little pulling up, but don't use any kind of pressure in there. The inner thigh down closer to the knee is fine to do. Some kneading and then a little more effleurage and back down. I like to give the leg a little bit of a pull at the end. And then move on to the second leg. And just repeat the process. This seems kind of weird. This is where the hardening of it is. It melts right away because there's some coconut oil in it, and there's a few other oils in this, which makes it kind of hard. It has a very nice viscosity of it, and colder days it makes it even a little more trying to get it melted. But there we go. Alrighty, and up the side, the thumb irons. I'm sure many of you have experienced shin splints. Shin splints are when you've pounded yourself pretty hard on the pavement and there's little tears that go on up along the shin bone. Sometimes it feels painful like a shin splint, but it's just lactic acid. And the way that you can tell the difference is when you get the blood circulating into the tissues. If the pain and the discomfort lessens, it's probably just lactic acid. And if the pain continues even with increased circulation, you've probably caused some tearing onto that area of the body, some tearing away from the bone, or just little tears in the muscle itself. If that's the case and somebody's working on you, they should be a little more cautious. Anytime there's injury or trauma on the body, you want to respect that and not traumatize it anymore by doing more aggressive techniques. And checking into the knee again. Around the knee, you check the feel of it. And here's kind of a thumb iron, but with the fingertips coming up that lateral side of the thigh. And then kneading across the quadricep area. Paying attention to that inguinal triangle, where you're going with that. And up into the hip socket, up along the hip bone. The leg actually starts up in here, so it's nice to go all the way to the end. A lot of times the legs are just presented about up to maybe shorts, and it's nice to get your hand up there to the joint itself. Okay, and then we give a little bit of a pull. A little bit of pull on both legs. And there we go. Okay. This is Athena Jezik. For more information, please check my website.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psyche Truth channel.